Wellness for Life is brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, Mahabi Atwa Community Action Partnership, Natural Alternatives, and Lakeside Sports and Pain Clinic.
Hi there, I'm Matthew Kaufenberg. I'm a physical therapist and I own Back in Motion Physical Therapy in Perham as well as Park Rapids, Minnesota. Today I thought I'd talk about a common running injury, a common knee injury. You know, the weather's starting to get nice here in Minnesota, so a lot of us are getting outside and being active. And for those of you who like to run quite a bit, there is one common injury called runner's knee that I thought I'd talk a little bit about today. I was just going to talk about the anatomy of it, and I was going to talk a little bit about why this type of injury occurs. So when you're looking at the knee, I'm just going to grab a model here of the knee. So this is a model of the knee. So basically we're looking at it just like this. So this would be a right knee. When you're talking about runner's knee, it's also known as Patella Tendinitis. So what happens if we can peel this is our patella tendon. So this would be the thigh bone, and then you have the large quadricep muscle. That quadricep muscle comes down and attaches into the tendon as it goes over the top, and I can peel this back, and it goes over the top of the kneecap, which we call the patella. So again, you've got this large muscle, the quadricep muscle. So this is our quad, and it comes over the top of the knee, and then it attaches down into our shin bone, or the tibia. So in runner's knee, what happens is right at the very bottom part of that kneecap. So again, I'm just peeling that back, so it would be right there, right at the very bottom of that kneecap. That part of the tendon actually starts to get really, really irritated. It gets inflamed, it gets stretched out, it just really becomes very painful, and it hurts when you run, it hurts when you do stairs. It's very difficult to kneel on the knee at that point, just because that whole region is just really, really irritated. So if we look at the diagram here, so again, I'm just kind of pointing out that those red X's, that's exactly where the issue occurs. So you have this blue patella tendon, and it attaches into the bottom part of that kneecap, and that's the region that starts to get irritated. It is considered an overuse injury. So why does that specific area get injured? Basically what happens is either the kneecap gets malpositioned or the kneecap moves improperly. So sometimes the kneecap will be positioned a little bit more off to the side, or the kneecap will move a little too far inward with every step that we take, particularly when we're running. So it's a kneecap malpositioning injury. So two things that typically will occur. You will either have what's called a muscle imbalance, where when we talk about a muscle imbalance, what we're meaning is one particular muscle group is too tight combined with another muscle that's too weak, so you end up with a muscle imbalance. When you have a muscle imbalance, that kneecap gets positioned wrong. So that's the first thing that can happen, or, as I was stating, the kneecap can move inward with each step that we take. So the first one is that muscle imbalance. So what will happen is the IT band, and the IT band basically starts from the outside of the hip and it comes down the outside of the leg. It's a very, very strong piece of connective tissue. That IT band, as it comes down, it actually has attachments on the outside of the kneecap. If that IT band gets too tight, it can start to pull that kneecap in that direction. So in this case, on my knee, my IT band here, if it starts to get too tight, the kneecap itself is going to be pulled that direction. So if that kneecap gets pulled in that direction in combination with a weak quadricep, so these red lines are the quadricep muscle, sometimes that quad will get weak. And if that quadricep gets weak, it can't hold the kneecap properly. So if that gets weak, if this gets tight, the kneecap will be positioned wrong. When that kneecap gets positioned wrong, I didn't draw this, but if you can imagine that kneecap being positioned over here, this entire tendon is going to be stretched out. It's going to be constantly being pulled right at that point of attachment, and over time that's going to get irritated. So if we think about why it occurs, then we can come up with solutions. So the solutions for this condition would be to try to increase blood flow very specifically right into this region. You need blood flow there so you can get rid of the inflammation. And then you also need to do some very specific exercises to stretch the IT band and to strengthen the quad. So in terms of increasing blood flow, there's a couple of things that we can do to increase blood flow. You can turn the camera over here. We can do a couple of things. When it comes to runner's knee, the take-home message here is you really should come and see your physical therapist, because you got to figure out why it's occurring, and there's some very hands-on techniques that we do to really help facilitate the healing. So the first thing that we can do what's called dry needling. And again, we're talking about increasing blood flow into that region. So we can use these needles, they're sterile needles, and we can take this sterile needle and we can actually kind of poke it right in that region. It's not the most comfortable treatment in the world, but it does significantly increase blood flow to that area, which will help reduce inflammation and reduce pain. So that's one thing we can do. We can also utilize what I call FRAMs. FRAMs is just fibrous release and myofascial stretching. It's very specific tools. They are stainless steel tools that we use. A lot of times we'll use a stainless steel tool and we'll come right to that point of the kneecap and we'll just kind of scrape it. And we get in there pretty aggressively and we scrape that region, and we're just trying to, again, increase blood flow to that area to allow healing to occur. And then on top of that, you want to do some very specific exercises, which if you were to come into myself, we would do quadricep strengthening and we would do IT band stretching. So that takes care of the muscle imbalance side of why this might occur. The second reason why this might occur is because of what we call femoral internal rotation. This bone right here is called our femur. This large bone as it comes down, that's called our femur. Femoral internal rotation is when that femur bone, with every step we take, so with the runner, you land, the knee bends, and it should bend straight down. But if that femur rotates inward, so this is called femoral internal rotation. If that femur rotates in, that kneecap is automatically going to go that direction. And then all of a sudden you're going to get a lot of pulling on that kneecap again, and you're going to end up with irritation. So femoral internal rotation, that typically is caused by flat feet. You would want to consider getting an orthotic. It is also caused by weakness in our gluteal muscles as well as our stomach muscles. So there's some very, very specific exercises that you'd want to learn to strengthen those areas so you don't get that femoral internal rotation. Again, you'd want to come and talk to a physical therapist to try to determine exactly why this is occurring and develop the right program for you to reduce the pain. If any of you suspect that you have this, please give me a call. If you have any questions about that, give me a call, 218-346-2464. Thanks so much for listening.
Thank you for watching Wellness for Life. Brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, Myofascial Ottawa Community Action Partnership, Natural Alternatives, and Lakeside Sports and Pain Clinic.